Hello and welcome. Today we're diving into a relatively uncommon yet significant complication following cataract surgery: calcification of the intraocular lens, or IOL. This condition can impact vision and requires careful management. Let's explore what it is, why it happens, and what can be done about it. So, what causes this calcification? The exact etiology is still under investigation, but several factors are believed to contribute. These include issues with the IOL material itself, particularly certain types of hydrophilic acrylic IOLs. Exposure to specific solutions during or after surgery can also play a role, as can underlying systemic conditions or medications. In some cases, the exact cause remains unknown, making it a multifactorial problem. Now, let's understand the pathophysiology. Calcification of the IOL involves the deposition of calcium phosphate crystals onto or within the lens optic. This process can begin on the surface and gradually spread through the lens material. The calcium deposits scatter light, reducing the clarity of vision. The calcification can range from a mild haze to a dense opacity, severely impairing light transmission to the retina. Calcification of IOLs is not a common occurrence. The epidemiology varies depending on the type of IOL used. Certain hydrophilic acrylic IOLs have a higher reported incidence compared to hydrophobic acrylic or PMA lenses. Specific populations or geographic regions might show slightly higher prevalence depending on surgical practices, water quality, or genetic predispositions. However, further research is needed. What are the signs and symptoms? Initially, patients may experience a gradual blurring or reduction in their vision. This can be accompanied by glare or halos around lights, making night driving difficult. In advanced cases, the vision can become significantly impaired. It's important to note that these symptoms can be similar to other eye conditions, so a comprehensive eye exam is crucial for diagnosis. Diagnosing calcification of the IOL involves a thorough eye examination. This includes a slit lamp examination, which allows the ophthalmologist to visualize the lens and identify any calcium deposits. Optical coherence tomography, or OCT, can also be used to assess the extent and depth of the calcification within the IOL. Sometimes, specular microscopy may be used to assess the lens surface. While there aren't rigid classifications of IOL calcification, it's often described based on the location and severity of the deposits. We talk about surface calcification when deposits are primarily on the IOL surface, and intrastromal calcification for deposits within the lens material itself. Severity may be graded on a scale based on the density and area of the calcification. This helps guide treatment decisions. The primary treatment for visually significant calcification of the IOL is surgical removal of the affected lens and replacement with a new IOL. In early cases with mild calcification, observation may be an option if the patient's vision is not significantly affected. There is no medical treatment to reverse existing calcification. The choice of replacement IOL is crucial and should be guided by the patient's individual needs and risk factors. Prevention strategies focus on minimizing risk factors. Selecting IOL materials known for their resistance to calcification is paramount. Meticulous surgical technique and avoiding potentially harmful solutions during the procedure are also important. Furthermore, systemic conditions which might increase calcium deposition should be managed appropriately to minimize their possible contributions. The prognosis following IOL exchange for calcification is generally good. Most patients experience a significant improvement in vision after the procedure. However, as with any surgery, there are potential risks and complications. Recent research is focusing on developing new IOL materials and surface modifications that are even more resistant to calcification. Furthermore, studies are investigating the exact mechanisms of calcification to identify novel prevention strategies. Long-term studies are underway to assess the performance of newer generation IOLs regarding calcification. Thank you for watching.